Welcome back, my people. Thank you for the support you are showing me in this channel, and it's my hope that you will keep the support on. Let's continue subscribing, sharing and commenting on our videos so that they may reach as many people as possible. I appreciate the far you guys have taken me. 7.5k subscribers, road to 10,000 subscribers. And if it were not for you guys, this channel could not be where it is. So let's continue with our discussion, whereby we were discussing about subserosal type of fibroid. And in this video, we are going to start by discussing the diagnosis, or how a doctor can tell that a patient or a lady is having subserosal type of fibroid. So in diagnosis, the doctor can discover cluster of fibroids during pelvic examination. For example, feeling pelvic structures including the uterus from outside with the fingers. Cluster feels like balls or fruit like an orange. So the first way in which a doctor can diagnose subserosal fibroid is through a pelvic examination, whereby the doctor will feel pelvic structures including the uterus from outside with the fingers, whereby cluster feels like balls, a fruit like an orange, during the pelvic examination by his or her fingers. Another way to diagnose this is through imaging tests. In imaging tests, the aim is to get better view of the fibroids and the pelvis. For example, you can do the ultrasound, you can do the magnetic resonance or MRI, you can do the X-rays, we can do CT scan. We can also do what we call hysterosalpingogram or HSG. We can do sonohysterogram. We can do sonohysterogram. We can also do a laparoscopy. I know the terminologies are so hard, but those are the most common methods used to diagnose. So in laparoscopy, a scope of bright, not this, a scope of bright light inserted into an incision near the navel or belly bottom to view. The aim is to view the uterus. So if you view the uterus by the aid of the torch and the bright light, if the uterus has the clusters of subserosal fibroid, you will be able to diagnose that this patient is having subserosal fibroid. Number 8, we have hysteroscopy. In here, long thin scope with bright light through the vagina and cervix into the uterus to look inside the uterus without making an incision. Let's come to the treatment modalities available for this kind of fibroid or subserosal fibroid. Treatment is not always necessary, but is given if only fibroids are causing problematic symptoms. I want you guys to get this. In subserosal kind of fibroids, treatment is not always necessary or important, but is given if only fibroids are causing problematic symptoms. So the first point in management or treatment of this kind of fibroid is what we call watchful waiting. As we had discussed in the intramural fibroid, watchful waiting also applies in subserosal type of fibroid. So in watchful waiting, fibroids are monitored for changes instead of undertaking immediate treatment. So this simply, watchful waiting simply means monitoring for changes instead of undertaking an immediate treatment, for example, surgery. Instead of going straight to surgery, you can decide to monitor the changes of the fibroids. Note this, several treatments are available for fibroids depending on the following factors. Factors which determine the treatment modality or the treatment type you are going to apply in this kind of a fibroid. One, the first factor which will determine the treatment is what we call the location of the fibroid. For example, where it is located. Is it inside the uterus, like in the case of intramural, or is it outside, like in the case of subserosal fibroid? Number two, we have type of fibroid, all fibroids. Depending on the type, you will find that intramural is inside the uterus or in the serosa. But like in the case of subserosal, it's outside. So this will also determine the treatment modality to use. Number three, we have what we call the size of the fibroid. Small fibroids may not require immediate treatment, but if it's large and causing problems or discomfort to the client, this can lead to a doctor choosing a certain type of treatment modality to use. Number four, we have severity of symptoms. Sometimes fibroids might be asymptomatic or may not have any symptoms. So if they have no symptoms, you will have no point of treating them. But if they start causing severe symptoms, this may lead the doctor to designing a certain treatment modality. Next, we have age. You may find that an elderly person having fibroid is not the same as a young girl with the same kind of a fibroid. So age is always a factor. Number 8, we have personal health and health history. Personal health and health history. Some of these procedures, all surgical procedures, need the patient to undergo anesthesia or to undergo a major surgery in theater. So if you are too old, your body immune system may be so weak, or if you have an history of a certain disease, your immune system may be so weak and may not warrant you to get through the anesthesia or to get to the theater room. Another point which may determine or another factor which may determine the modality or the treatment modality to be used is personal preference. Some people prefer the removal of the entire fibroid through surgery. Others may say, let's just sit and wait and see what happens, or go through what we call watchful waiting, as we have discussed above. The next point or the next factor which will determine the treatment modality to use is whether or not future pregnancies are desired. If you don't need any future pregnancy, or you have enough children, you might decide, instead of risking having this uterus, you may decide this uterus can completely be removed to avoid more complications. Number two, or the second type of a treatment that can be used after practicing the watchful waiting is what we call hysterectomy. Remember above we were discussing the factors that determine the kind of a treatment modality to be used. And hysterectomy is one of the treatment modalities available. The first one was watchful waiting or monitoring the changes instead of undertaking an immediate treatment. The second one is hysterectomy. This is surgery to remove uterus through an incision in the abdomen. This is a surgery whereby through the abdomen you remove the entire uterus. This is what we call hysterectomy. So let's discuss about the benefits of hysterectomy or the advantages of doing hysterectomy or surgical removal of the uterus through the abdomen. One, it's safe and effective. Number two, it completely eliminates fibroids and their symptoms. It completely eliminates fibroids and their symptoms. Number three, it's the only way to guarantee fibroids won't return or won't recur. I hope you get the 3 points, the benefits or the advantages of hysterectomy. One, it's safe and effective. Number two, it completely eliminates fibroids and their symptoms. Number three, it is the only way that guarantees fibroid won't return. Everything that has advantages or that has benefit, it must have disadvantages. So let's see the disadvantages of hysterectomy. Number one, it's a major surgery, which means it requires anesthesia. Number two, there is a possibility of surgery-related complications. Surgery-related complications. Number three, it takes 2 to 6 weeks to recover. It takes 2 to 6 weeks to recover, which is quite a longer period of time. Number four, there is risk of urine incontinence or unable to control urine. Next point, it ends menstruation and childbearing. It ends menstruation and childbearing. This means that if the whole uterus is removed through the surgery, you won't be able to conceive because you don't have a uterus. That's very simple. And also menstruation or getting your monthly periods comes to an end. Next point, one reaches menopause earlier. One reaches menopause earlier. This means you reach the age at which you can't bear a child or conceive or give birth too early than expected. This marks the end of our discussion about subserosal fibroid. And in our next video, we'll be discussing about types of hysterectomy. Types of hysterectomy. So guys, thank you for your support. Continue keeping the support on. I hope all those who have requested about this topic, you will get the information you wanted. Although we have not finished the topic, in our next subsequent videos, we will continue discussing the same until we reach the end of the all types of fibroids. Guys, continue subscribing, sharing, and commenting on our videos. Have a wonderful weekend ahead.